before we deep dive into some of the real world applications of Gen AI adoption in healthcare, let's one thing is pretty evident that the healthcare industry leaders have realized that the healthcare professionals are overworked. Experienced talent management is again a challenging area, and due to this, the quality of the healthcare is getting impacted. Moreover, things like the rising cost of healthcare is also a point of concern for the patients as well as for the providers. So, therefore, the use cases which we are going to discuss in the further slides that will revolve around the same theme or the same thought process, and we'll try to fix these gaps. So, let's discuss each one of these separately. Um, yeah. So coming to the first Gen AI adoption in healthcare use case, that is creating synthetic medical data using Gen AI. And this, in my opinion, is one of the most important use cases of Gen AI in healthcare. The important point to note here is that any such data creation on AWS cloud platform using the AWS native services could be patient agnostic, and it will follow all the necessary regional compliance and privacy laws. If I have to take a real world example of it, it could be that Gen AI can be leveraged to create a high resolution medical image, which could be used for training purpose, or it could be used for enhancement purpose. Other than that, another example could be, or another real world use case would be that Gen AI can also be used to create a 3D model for a surgery, which can help the surgeons to prepare well for a surgery in advance so that the actual surgery can be done in a more efficient and more successful manner. And from the implementation point of view, from Impulse's side, we have performed a POC for a customer on the EHR generation using the HL7 and FHIR based interoperability standards. Our team have also performed an AWS cloud platform based EHR patient registry kind of development, which is going to manage the patient health data records on the cloud platform. Now, if I again extend this synthetic data creation capability to a specific user perspective, and that is where the supporting clinical diagnosis kind of use cases will come in, which is basically we are using this synthetic capability to enhance the existing patient health record. A typical example or a real world implementation of that would be that suppose if a patient has taken an MRI scan, but due to some reason the result has come out poorly. Now, in a traditional scenario, patient has to do that all over again, which will not only cost him time and money, but the patient satisfaction will also be will be impacted. But with the case of Gen AI, we can simply enhance this low quality scan and make it a high quality scan. Therefore, it will not only save the time, but the, like I said, the customer satisfaction or the patient satisfaction will also be improved. Similarly, it will also save time to the healthcare provider as well, because a lot of back and forth is saved. Another real world implementation of it could be something in the case of anomaly detection. Herein, Gen AI can basically leverage the models to identify the anomaly in the patient health data and the scan information. So it can help in quickly identifying the underlying critical diseases like cancer, Alzheimer, or so on. From the real world implementation point of view, most of the organizations are currently using Gen AI capabilities in this area to support the clinical diagnosis, which is basically to fasten the whole process. That's how they are reducing the employee burnout, healthcare professional burnout, and overall patient satisfaction values also getting up. Okay, so extending the same theme, we can have another use case that could be the having as a personalized treatment plan for the patients. And what essentially it means that is that based on the enhanced clinical diagnosis, Gen AI models can also help in defining the personalized treatment and care plans by understanding the patient disease and treatment history across the providers. Gen AI can also play a vital role over here in quickly generating the suggestions for the for the optimal drug usage or on optimal drug combinations, and that combination can be based on the patient drug usage history, its allergies to certain food or to certain medications, its resistance to food, and so on. And collectively, these insights can provide it can help the healthcare providers to give a better understanding, or it can basically allow them to make a better decision on how the treatment or which way the treatment should proceed. If I have to relate this with the real world usage scenario, since the COVID pandemic, healthcare providers have experienced that the chances of flu like diseases occurring in the patients which were severely affected during the second wave of the COVID is fairly high. So, Gen AI can be leveraged over here to provide preventive care to such patients by forecasting their health condition based on what is going on, and it can basically help in reducing the overall load on the healthcare infrastructure by forecasting such conditions. Another one of the most important use cases is enhancement of training and medical training and the simulation. And this is very important because Gen AI has the ability to create more realistic training simulations based on the data sets which are emulating the real world scenarios. And this again is very relatable because what industry has learned is that in the case of healthcare and allied healthcare professionals, there is a huge gap between the classroom trainings and the real world scenarios. So Gen AI can basically help in bridging this gap by creating a real life simulations or creating a on the fly use cases based on the learning pattern, and it can also create the simulations for the surgeries, medical procedures, how to manage the diseases, and so on. Uh, any other than that, based on the each candidate feedback and how a candidate is faring in medical training, a generative AI can also tailor these use cases or tailor the content of the training as well to provide more immersive kind of training experience. From the Impulses side, we have helped several of our customers to create more realistic training experience using the Gen AI toolsets on the AWS cloud platform. Furthermore, we also have some Gen AI offerings with respect to chapter summarization, Q&A generation, important pointers generation, etc. And these offerings can be integrated into healthcare training and simulation kind of solutions. Coming to the population health management. Now, with respect to a patient, Gen AI can perform disease progression modeling for a particular patient, and it can summarize that whether the current treatment plan, medication plan, diet and nutrition plan is whether it's working out for a particular patient or not, and how well a patient is responding to that treatment. But if we try to extend this use case to a larger population point of view, we see that it unlocks basically a lot of potential. From the broader perspective, Gen AI can play a significant role in analyzing the current disease patterns across the patient age groups in a specified geography. And it can also quickly summarize and come up with a prediction of the potential disease outbreaks and what would be the various ways of preventing that and how it has to be, and what devices or what medications are needed in case of an outbreak. And this is something exactly which a lot of governments and a lot of healthcare organizations did at the time of COVID-19, that they used the COVID-19 model, they used the Gen AI modeling to model the COVID-19 outbreak to prepare themselves from the future waves by stocking up the necessary medications, healthcare resources availability, vaccines, and so on. And lastly, from the patient engagement point of view, this is again one of the most impactful area of Gen AI in healthcare, because from the real world scenario, not only Gen AI can be very useful in automating basic tasks like scheduling the appointments, scheduling the test, sending the reports across, creating some virtual or smart AI assistants, setting up kind of like follow-up reminders. These are like the common tasks which a Gen AI can do for patient engagement. But other than that, it can also integrate with the wearables like smart watches and smart rings. The idea here is to assess the real-time patient health monitoring data, find the anomalies in the data to prevent the diseases from happening. So essentially, what we are trying to do is we can provide 24 cross 7 silent user health monitoring or more holistic health monitoring of the patient without even them noticing it. In terms of the real world implementation of it, already big smartwatch manufacturers are planning to integrate the Gen AI capability in their operating systems or in their products. Currently, Gen AI is integrated in a limited capacity as it is currently being used to generate the insights and to process the insights at the cloud. However, going forward, smartwatch manufacturers are planning to integrate it at the OS level so that processing can be done locally. Moreover, it will also provide more conversational and more personalized kind of insights to the end users to for the effective preventive care. So yeah, these are some of the interesting areas for Gen AI adoption in healthcare.